Good day, folks. Thank you for joining us here at Your Health. On today's program, we would like to talk about alpha-lipoic acid. This remarkable substance is perhaps the most unique and diverse substance we have in the supplement world. It can be used for a wide variety of conditions. When I think of alpha-lipoic acid, I think of it helping someone who is stuck in poor health or delayed healing. If your health is in that type of situation, you've been doing everything you can think of, but you're still stuck in that ditch of poor health. Alpha-lipoic acid could make the difference for you today. On today's program, we want to help you understand why alpha-lipoic acid is so useful for so many different conditions. That's our topic for today. First, let's go to our news. Let's see what's happening in the health world. People often ignore early warning signs of cancer. Researchers from Cancer Research UK conducted a health questionnaire concerning disease symptoms on 1,700 adult subjects. They found 53% experienced body symptoms over the past 3 months that could be attributed to cancer. However, only 2% of the subjects thought cancer was a possible cause. The study also found even if the person had symptoms that they thought were serious, they rarely attributed the symptoms to cancer. Folks, this one's critically important. Far too often we ignore the early warning signs of cancer. Even if we think the new sign or symptom is an indicator of a serious health problem, we almost always attribute the symptoms to some other health condition than cancer. Now, one of the most important principles of cancer treatment is that we recognize cancer signs and symptoms early, so our cancer treatment options are more effective, and because our cancer, as it progresses, it robs us of our strength and will to fight these deadly diseases. It is far better to make an appointment with your doctor only to be told it's nothing serious than to ignore cancer's early warnings. Now, the American Cancer Society has recently published a list of the most common early signs and symptoms of cancer. They are unexplained weight loss, meaning you're not trying to lose weight, yet you've lost 10 or more pounds over the past few weeks. Unexplained fever, no obvious signs of infection like a sore throat, yet fever persists. Fatigue beyond that caused by physical exhaustion, a new and unusual persistent pain, skin changes such as a sore that will not heal, lumps or masses, and the development of multiple colors in a mole. You may see excessive hair growth, jaundiced skin, or red and inflamed skin. Also changes in bowel habits or bladder function, unusual bleeding or discharges, changes in digestion, appetite, or swallowing, and of course, a persistent cough. Now, please understand that when these symptoms occur, they are not always a sign of cancer, but why take the chance? Get them checked out. Foods rich in potassium help to prevent osteoporosis. Researchers from the University of Surrey report for the first time the regular consumption of potassium-rich foods, such as fruits and vegetables, reduce the reabsorption of bone, thereby reducing the risk of osteoporosis. The study revealed that the high intake of potassium reduces the excretion of urinary calcium and acid. The study was published in Osteoporosis International. Well, this is good news as we learn of yet another tool to help prevent osteoporosis. I think everyone knows that foods rich in calcium help to build and preserve bone mass, and we've known for some time the regular consumption of fruits and vegetables preserves bone mass as well, but we did not know the exact mechanism. Now we learn for the first time potassium salts as found in fruits and vegetables help to counter the blood and urinary acidity created by a high meat and cereal grain diet that is so typical here in the U.S. Foods rich in potassium include bananas, citrus, papaya, grapes, raisins, mangoes, melon, pears, peaches, apples, and many, many more fruits and vegetables. It is the wise person who includes these foods in their daily diet. Continued alcohol warnings to adolescents makes a difference. Researchers from the University of Buffalo conducted annual assessments of parental and adolescent interactions concerning alcohol use over a 3-year period. They found parental attitudes affects adolescents' attitudes and subsequent drinking behaviors in general. They also found if parents discuss alcohol warnings with their children early, then do not discuss it again, the adolescent was much more likely to engage in early drinking. Continued dialogue between parents and children concerning alcohol led to the lowest risk of underage drinking. The study was reported in the journal Addictive Behaviors. Folks, this is the second study we've reported this year that finds continued conversations with our children help to reduce underage drinking. These studies were conducted on alcohol use, but it makes sense to me that the same would hold true for drug abuse as well. What is unique about this study was the finding that just having one or two discussions about alcohol are not as effective as continued dialogue throughout adolescence. Don't assume your early teen fully understands alcohol and drugs dangers. Keep talking. It could save the life of your child. Today on Your Health, we'd like to discuss alpha-lipoic acid. Stay tuned to learn more.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Richard Becker for Your Health at a Glance. High cholesterol raises your risk for cardiovascular disease, but it's just one risk factor among many. And the need to lower your cholesterol can be over-exaggerated. Everywhere in the media, we see advertisements for cholesterol-lowering prescription drugs. It's a big business. Now, cardiovascular disease kills more Americans than any other disease, so we need to pay attention to all the risk factors for heart disease. Here's a prevention strategy. Besides lowering your cholesterol, treat high blood pressure. Stop all tobacco, manage diabetes, exercise regularly to stay fit, avoid sugar, eat fish and fresh fruits and vegetables. Take your daily vitamin and use omega-3 oils. Address all your risk factors, not just your cholesterol. For Your Health at a Glance, I'm Dr. Richard Becker. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. Welcome back, everyone. It is such a blessing to be with you today. We have a great show planned. We're going to be talking about the conditionally essential nutrient alpha-lipoic acid. You might have heard about alpha-lipoic acid and its role to help the diabetic, which it really does. But you're going to learn today there's so much more to this than just helping the diabetic. It really has a widespread application. So, Richard, what is alpha-lipoic acid anyway?
Well, it's a remarkable substance, and it owes this remarkable nature to its unique molecular structure. It really is an amazing substance that can help so many people. We will use the term alpha-lipoic acid, but it's also known as lipoic acid, thioctic acid, or dithiooctanoic acid. Alpha-lipoic is easier. We're just going to keep it simple, alpha-lipoic acid. It is an organosulfur compound that is both soluble in fat and water. It works inside and outside of the cell. It's produced in the mitochondria of the cell. That's the energy generator of the cells, the mitochondria, and it's primarily used there. Now, notice I called it an organosulfur compound, not organosulfa. Sulfa is a drug moiety. It's part of sulfa antibiotics, and other chemically related substances. That's what you're allergic to. You're not allergic to alpha-lipoic acid. And I wanted to make that distinction because this substance is in every single human being. So you're not allergic to that. You're allergic to a different form of sulfa. It's a different substance. Alpha-lipoic acid, it can be found in both right-hand and left-hand molecules, but only the right-hand version is used in our bodies. This is called a chiral molecule. Chiral is the Greek word for hand. It's the mirror image concept. It's the same molecule, but it's different. This hand's the same as that hand, but it's different. It's the concept, and I think everyone's familiar with that. R form is what our body uses. If you take a supplement that has both right and left molecule, it gets rid of the left and it uses the right. The right-handed lipoic acid sodium salt is water soluble. It helps to make it more soluble so you can get it into your body. It resists polymerization. If something falls apart in your stomach and degrades and then it just clumps back together, it's polymerizing again and you can't absorb it. So it resists that polymerization and it's rapidly and completely absorbed into the system, equal to IV dose. And there's been a lot of research proving oral administration of lipoic acid equals IV dosage. And this is very important because a lot of our research is done with IV techniques, so it's reproducible and you can be very exact with it. But taking it orally works. Lipoic acid was once thought to be an essential vitamin, but now we know it is made by our bodies, but levels drop with age and disease, hence, as Cindy said, conditionally essential nutrient. It's the next part of this discussion is the crux of how alpha-lipoic acid works. It's complicated, so I'm going to tell you the exact descriptions of how alpha-lipoic works, and then I want to go back and interpret it and explain it to you so everybody can understand. If you understand how alpha-lipoic works, then you can apply it to many different uses. It's really the key to understanding alpha-lipoic acid, so bear with me with this. Alpha-lipoic is an essential cofactor of 4 different enzyme complexes that generate ATP from glucose. It is essential for life and aerobic metabolism. When you ingest it, it increases ATP production. Lipoic acid activates multiple enzymes via NFK-kappa, nuclear factor kappa beta, to initiate DNA transcription, resulting in regulation of nitric oxide burst and blood pressure control, glutathione production, glucose metabolism, activation of phase 2 detoxification, activation of cytoprotection mechanisms, wound healing, initiation of metallomatrix enzyme, which controls growth and cell structure integrity and vascular integrity. That is the primary function of alpha-lipoic acid. That's a mouthful. Let's go back and interpret this so we can all understand it. It is an essential cofactor for 4 different enzyme complexes that generate ATP. We've learned that CoQ10 helps the mitochondria make ATP. It is influential in one major step. Alpha-lipoic acid influences 4 different steps. It binds to the enzyme. It actually chemically binds it, changes the structure of the enzyme, making it efficient and more able to produce alpha-lipoic acid. It is essential for life and aerobic metabolism. It has been estimated if you could magically remove all of the lipoic acid from your body, you would be dead within 5 seconds. It's that critical to life. Thank goodness no one's figured out how to do that. It increases ATP production when we take it internally. That's obvious. Lipoic acid activates multiple enzymes via the nuclear factor kappa beta to initiate DNA transcription. Any type of stress to our system, an immune insult, you come down with the flu, you have stress, you're working hard, cytokines, the release of prostaglandins and things from injury, you rupture a disc or you break your ankle, swelling and inflammation occurs. Any type of free radical production, this nuclear factor kappa beta is produced with the aid of alpha-lipoic acid to stimulate the DNA to compensate, to calm the inflammation, to speed the healing. So alpha-lipoic acid has a direct effect onto the DNA production of RNA and hence enzymes to control all these various functions throughout our body. And these various functions include the regulation of nitric oxide burst and blood pressure control. How much blood is flowing through the artery? It's controlled via alpha-lipoic acid. Glutathione production. Glutathione is one of our most fundamental antioxidant systems that helps to counter toxic byproducts of metabolism. If we didn't have something to get rid of these free radicals, we would not live long at all. And so glutathione production is regulated via intervention of alpha-lipoic acid. Glucose metabolism. If you're having an accumulation of glucose, we call that diabetes. Alpha-lipoic acid can stimulate through this NF-kappa beta to instruct the DNA to improve your glucose metabolism. Isn't that amazing? So it has a direct effect through the DNA and your cellular mechanisms. Activation of phase 2 detoxification. This is what we call the conjugation detoxification. What this means is, let's say you have a small molecule that's highly active, like formaldehyde. That would be like embalming fluid. Well, in phase 2 detoxification, directed through alpha-lipoic acid, it adds another molecule to the formaldehyde so it's not toxic. So we change the chemical nature of these toxins through the influence of alpha-lipoic acid. Cytoprotection, same concept, protecting the cells, the mechanisms that protect the cells, it's influenced by the alpha-lipoic acid through the DNA and the natural mechanisms that the cell has. Wound healing. Yeah, any kind of wound, alpha-lipoic is involved in initiating the healing of the wound. And metallomatrix, that's one of the enzymes that lays down new tissues. If you have a cut, laying down the new tissues, everything's held together. Cell structure, integrity, vascular integrity, that's the primary function of alpha-lipoic acid. Also, it stimulates the immune system with the production of B cells, it's a specific type of specialized lymphocyte that makes antibodies. So this would help your immune system. All of this is done directly and indirectly through alpha-lipoic acid. That's one main category. The next main category is it functions as a powerful antioxidant. It can scavenge a wide variety of reactive oxygen species. It can be oxidized twice, it's so powerful. The reduced form, once it's been oxidized once, recharges vitamin C and E. We call that the dihydrolipoic acid. It's not important you know that. It is important that you understand alpha-lipoic acid is a powerful agent to help your body to heal and recover. It is so effective in normalizing physiology. Studies have shown if you add omega-3s, acetyl-L-carnitine, B vitamin to alpha-lipoic acid, it will return age-related biomarkers to that of a youthful level. We can check the metabolism of an 85-year-old man and it tells us that this is an 85-year-old man. Give alpha-lipoic acid, B vitamins, omega-3s, acetyl-carnitine, they return to that of a 25-year-old. It's that effective in kickstarting the healing processes of the body. It's soluble in both fat and oil. It readily penetrates the blood-brain barrier where it protects from neurodegenerative diseases, and you now know how that works. It distributes throughout all the organs of the body and body parts. It attaches to the enzymes, altering their shape into an active form that promote healing and disease-fighting abilities. Pretty amazing, isn't it? Pretty amazing. So after the break, we'll go to the studies, the current scientific study, to see the many uses of alpha-lipoic acid. We'll be right back.
Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. I'm Cindy Becker for Your Health at a Glance. How often do you go into the grocery store to buy just a bag of chips or candy bar? I suspect not very often. Then how is it that these foods make it into our grocery bags and pantries? Do you make impulse choices and buy junk food? To control that impulse, plan your next trip to the store. Write down at least 3 days of menus and build a grocery list with the ingredients needed to prepare the meals. Eat a healthy snack before going to the store. If you are hungry, you're less likely to stick to the grocery list. Shop the perimeter of the store, starting with fruits and vegetables. Have you ever noticed the most healthy foods are in the outer aisles? And avoid items displayed at the checkout counter, trying to entice you to make a last-minute purchase. Follow these tips and make a plan so your next trip gives you control and you come home with bags full of healthy food. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We're back, everyone, having a fascinating discussion about alpha-lipoic acid. Isn't this interesting information? And I've got to tell you, before we carry on with the show, it is December holiday savings time at BioInnovations. You know all about it. It's a great, great, great time to get the nutrients that you need to stay healthy for the holiday season. Who wants to be sick at Christmas time? I know I don't. So you want to do everything you can to stay healthy. Well, great prices and free shipping on orders over $50. Of course, that's in the mainland USA, but don't miss it. So Richard, before we go on to the research,
yes,
I think there's a little bit more in the history and perhaps some facts about,
yes,
I like to call it fun facts, but just
perspective
little,
here.
About alpha-lipoic acid.
Well, lipoic acid has been used in Germany for over 60 years now, where it's classified as a drug for the use of diabetic polyneuropathy and advanced liver disease. In Germany, it's been studied very, very thoroughly, and it's a prescription item in Germany. But we can get this over the counter here in the United States. It is a classic orthomolecular molecule in the Linus Pauling tradition. And if you know about orthomolecular medicine, that basically means it's the right molecule for the right job. And what that means is no drug can do what alpha-lipoic acid does. If you have a problem and you're covering up the symptoms with drugs, you're making a mistake. You need to support the natural healing mechanisms that help us to heal and promote good health. This is how we do it. You can have medicine with it, but cover the foundational aspects too. And now that you understand how alpha-lipoic acid triggers the DNA in our system, the code of wellness, and so that it can metabolize our glucose better, so it can heal better and fight off insults and free radicals and toxins, it's all supported through alpha-lipoic acid. No other molecule does that. It's important to understand that. The physician's desk reference for dietary supplements states alpha-lipoic acid has no significant side effects and no known drug interactions. It may upset the stomach and cause a minor rash at extremely high doses, and very few, if any of you, need that high a dose. Small doses work quite well with alpha-lipoic for most people. It may lower blood glucose in poorly controlled diabetics, but that's what we want. Remember, we're trying to get that glucose metabolism under control, and alpha-lipoic acid could do it. But diabetics, if you start to take alpha-lipoic acid, you may need less medicine. But wouldn't that be a good thing, less medicine? That's always the best way to approach things. Alpha-lipoic acid can be administered IV or orally. They both attain basically the same drug level, supplement level in the bloodstream. You will see notations on the internet that says there's no meaningful evidence that alpha-lipoic acid works, and that's just an outright lie, folks. It's not true at all. They're hoping you will believe that. The truth is alpha-lipoic acid is a remarkable substance that can help a lot of people. Let's go to some of the studies and let's find out. Alpha-lipoic acid, 4,130 some studies at PubMed alone. That's about a 40% growth in 2 years. It's exploding. People are very interested in alpha-lipoic acid. We have 292 human trials and 108 double-blind placebo-controlled trials. We know a lot about this substance. We know, if we overview the research, that alpha-lipoic acid is helpful in diabetic neuropathy. It's helpful in neurodegenerative diseases, endothelial dysfunction, cardiovascular disease, and left ventricular dysfunction. The left ventricle isn't pumping very well. You're not going to have good circulation. It helps with that. It is useful in cirrhosis, lumbar disc disease, carpal tunnel disease, spinal cord injury, burning mouth syndrome associated with chemotherapy or radiation and cancer, end-stage kidney disease. It improves exercise tolerance. It is a powerful antioxidant, and it helps to reverse the signs of aging. Let's go to diabetes. This is probably the most common use of alpha-lipoic acid. What do we know? Diabetes and metabolic syndrome creates reactive oxygen species, free radicals, damaging things, oxidative stress, and glycation of proteins. This is what leads to the microvascular disease, the capillary disease of diabetes, which leads to kidney failure, loss of vision, heart disease, neuropathy, amputations, all of it. It's a disease of the microvasculature. Alpha-lipoic acid counters those factors in the diabetic. And you know how it works now, too. It's pretty amazing. Helps insulin do its job. It counters the free radicals. It acts as an antioxidant. It has that direct DNA effect that we learned. It reduces toxic protein metabolites. It reduces asymmetrical dimethylarginine toxins that interfere with arginine and nitric oxide bursts. You've heard of homocysteine and how that can accumulate and lead to heart disease and dementia. This is basically how homocysteine comes about, through these asymmetrical dimethylarginine toxins. Alpha-lipoic acid turns on your healing and repairing and your antioxidant and your free radical scavenging abilities, and it counters that. It does this for the diabetic. Improves endothelial dysfunction, restoring blood to the capillaries. You know, blood doesn't work in the arteries. It doesn't work in the veins. It does its job in the capillaries. But the capillaries are diseased in diabetes. Alpha-lipoic acid helps to reverse that phenomenon, and it's quite effective in doing so. It improves measures of glucose control in a dose-dependent manner. In other words, 300 milligrams will reduce your sugar a little, 600 will reduce it more, 900 even more. Dose-dependent response in alpha-lipoic acid. It improves fasting glucose, postprandial glucose, the long-term hemoglobin A1C, long-term average glucose, it reduces that. It improves cholesterol levels, meaning it drops them, while improving wound healing and better oxygen utilization. The whole thing of metabolism is improved through 4 different enzymes, remember, producing better utilization and production of ATP. Protects the nervous system, including the heart's nerve conduction system in diabetes. But you don't have to be a diabetic to have benefit from alpha-lipoic acid. Metabolic syndrome improves with alpha-lipoic acid. If you're not diabetic yet, but your glucose is up a little, your cholesterol's up a little bit, triglycerides are up, blood pressure's, you know, it's the metabolic syndrome. It improves all of those measures. It can help you avoid developing diabetes if you're metabolic syndrome. Get a little exercise, you know, a little milk thistle, some of these other things. It is not an inevitability, this diabetes. Diabetic neuropathy, it improves the pain, the numbness, the paresthesia. It is the most studied use of alpha-lipoic acid, is diabetic neuropathy. Diabetic polyneuropathy, it's a major complication of diabetes. It's caused by the microvascular, the capillary insult from diabetes. This damages the capillaries and the capillaries that supply nutrients to the nerve. That's the basic mechanism of the neuropathy. It also affects the autonomic nervous system and the nerves of the intestinal tract. So all of these things can go awry in diabetes with neuropathy. Numbness, tingling, burning, electrical pain. And in the intestinal tract, diarrhea, incontinence. Up to the brain, dizziness and altered organ function. You hear of this gastroparesis associated with diabetes. That's a form of neuropathy. Alpha-lipoic acid helps that. We have multiple double-blind placebo-controlled trials. The Aladdin 1, 2, 3, the Sydney 1, 2, 3. These are all big studies on alpha-lipoic acid. The Nathan trial and at least 5 others. Alpha-lipoic acid has been studied in every major country around the world for its use in diabetes with good results. Alpha-lipoic acid provides quick reduction of burning, tingling, pain, and numbness to the extremities and the organs. It's been studied for up to 4 years of use in diabetic neuropathy with sustaining relief. It doesn't just help for a while and then quit. It continues. It's been studied with vitamins, medications used in diabetes, pain medication used in diabetes, vitamins, antioxidants, and alpha-lipoic acid makes all of those work better for the diabetic. So don't you believe it, folks, when somebody says, oh, we don't know that much about alpha-lipoic acid. All you really can use is drugs for the treatment of diabetes. You know the truth now. Alpha-lipoic acid helps the diabetic and it helps neuropathy. We'll be back with more on Alpha.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
Dr. Becker, and this is Your Health at a Glance. Are you one of the millions of Americans who are at risk for heart problems? If your diet is like the average American's, you're getting far more sodium than your body needs, and this may create serious problems for your heart. A new study from the Netherlands showed that a diet high in salt not only increases blood pressure to dangerous levels, it also causes damage to your blood vessels. To avoid these problems, you need to avoid foods that are high in salt, such as preserved and prepared foods like frozen dinners, canned soups and other canned foods, cured meats such as lunch meat, hot dogs, bacon and sausage, condiments and sauces such as soy sauce, teriyaki sauce, and spaghetti sauce, and snack foods such as salted nuts, pretzels, and chips. Eat fresh fruits and vegetables, fresh meats, poultry, fish, and other salt-free alternatives. As you decrease your intake of salt, your desire for salty foods will eventually be reduced. For Your Health at a Glance, I'm Dr. Becker.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro-defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. We are back. I've got to give you a little reminder. It is savings time at BioInnovations. Fantastic, fantastic prices, best prices of the season, and free shipping on orders over $50 in the mainland USA, so a great time to get what you need. Well, before we go on, I have a question for Richard.
Yes.
So, if I did have diabetic neuropathy, which I know is so painful and affects so many people, how would they know how to dose alpha-lipoic acid?
Well, it's been studied at multiple levels. It's been studied at 300, 400, 600 a day, 800, 1200, 18, 24, and what's remarkable is every single dose helps the diabetic neuropathy. It takes a little longer with the lower dose, and it would depend on how severe your condition is. I would start with around 1,200 milligrams a day, and the studies show within 2 to 3 weeks you will begin to get relief. And as you're getting relief, you can reduce your dose to the least amount to get the job done effectively. That just makes perfect sense. Save your money where you can, but get it done right. You know, get the relief, and then you can reduce your dose as time goes on. Now, there's other problems for the diabetic as well. What about cataracts, fatty liver disease, and the retinopathy and the kidney disease? All of this has been studied with diabetes, and alpha-lipoic acid helps these conditions too. It even inhibits the enzyme in the eye that leads to diabetic cataracts of the eye. The best way to do that is alpha-lipoic acid in solution in eye drops to the eye, but I would imagine over time systemic use would help that too, but I don't have a study to back that up. Also, macular degeneration, we have studies on that. It helps to control the high pressure glaucoma that is so common now, and it improves hyperbaric oxygen therapy effectiveness for wound healing in the diabetic. This is something that the diabetic is constantly challenged with, little nicks and wounds, especially in the feet. The further from the heart, the more serious this can become. And weeks and months, and these wounds do not heal. Alpha-lipoic acid helps this process in healing. And if you need hyperbaric oxygen treatment, you know, force the oxygen in with high pressure, alpha-lipoic acid makes that work even better. Isn't this amazing? Now let's go to the next general category. It's not just for diabetes. Alpha-lipoic acid helps cardiovascular disease, atherosclerosis, heart disease, and peripheral vascular disease. Reduces cholesterol, preventing the oxidation of LDL cholesterol. It reduces and inhibits the basic phenomena that leads to vascular lesions, that ultimately leads to heart attack and stroke and peripheral vascular disease. And you know how it works now. It works through the DNA. Get this, you can take alpha-lipoic acid, reduce your blood pressure from it, but increase your cardiac output. Think about that for a minute. How much blood flows depends on how often the heart's beating and how much resistance and how much fluid. You can increase your cardiac output but lower your blood pressure, and this is a big benefit because it perfuses, that increased cardiac output perfuses your organs with life-giving blood. But you do it without increasing your blood pressure. If you do it with increased blood pressure, you're going to shorten your life. Pretty amazing, isn't it? Lessens the damage of a heart attack or stroke by decreasing reperfusion. If you should have a heart attack while taking, or a stroke while taking alpha-lipoic acid, the damage will be reduced because of its powerful antioxidant properties. Slows atherosclerosis progression. When combined with vitamin E and C, it reverses endothelial dysfunction in elderly subjects. This is a great combination, folks. Vitamin E, vitamin C, alpha-lipoic acid. I would add vitamin D to that, too. Be tremendous. Reduces the pain of claudication from peripheral arterial disease. When you walk to the mailbox, do your legs just ache and you just have to stop and let it rest, and then you can get up and go a little further? That's peripheral artery disease, and it's called claudication. You will be able to walk further with alpha-lipoic acid. It's that effective. In the diabetic patient with hypertension, alpha-lipoic acid, when combined with an ACE inhibitor, reduces vascular damage and proteinuria more than the ACE alone. Diabetic, you go to the doctor, they check your urine. Oh, you got the protein in the urine. It means your kidneys are being damaged. They put you on the ACE inhibitor, angiotensin converting enzyme, to lower your blood pressure and to protect the glomeruli in the kidney. That's good medicine. That's the thing to do. But add alpha-lipoic acid to it. It makes it even work better. Reduces the proteinuria, spares the kidney in diabetes. Important information, folks. Metabolic treatment for heart surgery. You know, we've heard about metabolic cardiology from Dr. Sinatra. CoQ10, carnitine, magnesium, D-ribose, fish oil. You know, these are also very important. They found if you add the alpha-lipoic acid to that combination, significant improvement in cardiac surgery outcomes. Protect the heart, protect the heart. Let's talk a little bit about musculoskeletal problems. So many of us have chronic pain and ongoing disc degenerative disease and pinched nerves, and you're suffering with this. It attenuates, alpha-lipoic attenuates the inflammation, and they know how it works. Alpha-lipoic acid, again with the vitamin C and E combination, improves muscle performance and perfusion in seniors. You will be able to work better in the garden. You'll be able to walk around the grocery store better You'll be able to walk to church and back better with alpha-lipoic acid, and it's been proven in good studies. Add your good multiple vitamin for the E and the C, alpha-lipoic acid, CoQ10. Boy, it's going to make a difference for you. Relieving suffering. This is what it's all about. Alpha-lipoic acid and GLA, which is alpha-lipoic acetyl L-carnitine, improves pain and nerve function along with quality of life. This one's really important. I know I'm going fast, but bear with me. Alpha-lipoic acid and acetyl L-carnitine improves pain and nerve function along with quality of life in ruptured disc patients. Alpha-lipoic acid, acetyl L-carnitine. Please add vitamin D and fish oil to that. You know, I spent a lot of years helping chronic pain patients in practice. It was my main work as a physician. And I found 9 out of 10 patients were stuck in chronic pain because they were malnourished. They weren't taking their vitamins, they were eating a poor diet, they were miserable, and they focused on comfort foods. You can see how you can become nutrient depleted in that scenario. Get on a good vitamin plan, vitamin D, alpha-lipoic acid. You can begin to heal and your pain will decrease. It's amazing to see. Let's go to our break, and when we return, we have some unique attributes of alpha-lipoic acid when we return.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year. Is our hope for you today. I'm Cindy Becker. Christian counselor Dr. Henry Brandt wrote, "To dwell above with the saints we love, that will be grace and glory. But to live below with the saints we know, well, that's another story." Throughout our lives, we encounter difficult people. These souls challenge the best of us. But the Apostle Paul suggested that we maintain our grace in spite of the actions of others. Paul wrote, "If it is possible, as far as it depends on you, live at peace with everyone." Paul acknowledged it may not be possible in all cases, but we should still do our best. Try to look at difficult people through Christ's eyes. Remember his sacrifice was for everyone, even those saints we know who challenge us. I'm Cindy Becker. This is our hope for you today.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
Bioinnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the auto ship program for additional savings. Call today.
We're back, everyone, talking about alpha-lipoic acid in your health. Isn't this just amazing? So, Richard, the next section is really going to be great because there's just all these varied uses that alpha-lipoic acid is great for. We really don't stop and think of it for.
No, we don't. Well, when doctors saw how well alpha-lipoic helped with neuropathies, they thought, well, maybe it would help with the neurodegenerative brain diseases like Alzheimer's disease, Lou Gehrig's, this type of thing. Remember, the alpha-lipoic acid is soluble in fat and water. It goes right into the brain. Not everything can do that, but alpha-lipoic does. It stabilizes the brain, and it helps to turn on the detoxification processes in the brain. They've been able to show that if you take the alpha-lipoic acid with omega-3s, you can stabilize the progression of neurodegenerative diseases. Now, it's not a cure, and I don't mean to imply that it is, but these are steps that can improve quality of life and prolong independence. We're all going to pass in this world. We've gotten used to that idea, haven't we? If our days can be with less suffering, less pain, and more independence, it's a good thing. And so there are definitely plans to help with the cognitive decline associated with aging and the neurodegenerative diseases. Shows great promise in the neurodegenerative diseases, ALS, Parkinson's, Alzheimer's, and the various forms of dementia. And work is going on, but in the meantime, your B vitamins, your vitamin D, your omega-3s, alpha-lipoic acid, ginkgo, curcumin, acetylcarnitine, exercise. This is a program that will help you stay sharp for years to come. Alpha-lipoic's use in toxicology, this one is fascinating. It is an excellent chelating agent for heavy metal poisoning. It's been studied for use in copper overload, lead, mercury, arsenic, antimony, cadmium, and iron overload. All of these respond favorably to alpha-lipoic acid. It's a good antidote for cyanide poisoning, streptomycin, mushroom poisoning. See, now, you know how that works now because you did the effort, you took the time to come to understand how alpha-lipoic works in our cells through the DNA. Protects the liver from carbon tetrachloride poisoning, protects the liver in diabetes, including acetaminophen poisoning. There have been cases of hepatic coma completely reversed and the patient awakening with 1 dose of alpha-lipoic acid. That has also occurred with 1 dose of probiotic. Do not discount this. It can really help the liver in cirrhosis and hepatic coma. Here's an important one. Alpha-lipoic acid has been shown to absolutely mitigate the hormone disruption of the xenoestrogens, the pollution that affects our hormone, these hormone-disrupting pollutants. Alpha-lipoic acid completely ameliorates this, and it's been shown in animal studies to do that. Kidney disease, end-stage kidney disease. On dialysis, 600 milligrams of alpha-lipoic acid a day reduces the inflammation in the kidney and improves the outcomes here. Provides endothelial dysfunction attenuation in chronic kidney disease, whether it's from diabetes, hypertension, whatever cause. Free radical load is reduced. Rich Schneider, nephrologist, he's been on this program and he wrote 2 beautiful books about kidney disease and dialysis. He tells us, he recommends dialysis patients for 2 weeks or so, take your antioxidants, reduce the free radical load in the kidney. Things like alpha-lipoic acid, grapeseed, vitamin C and E, curcumin, resveratrol. Then after 2 weeks, after the free radical load is reduced, go to the cordyceps, add it. Continue the antioxidants, add the cordyceps. Remarkable results when we do this. Get the book from Richard Schneider and read it. Learn more about what you can do with supplements for kidney disease. All right, here's some unique potpourri, as it were, of uses for alpha-lipoic acid. Prevents organ dysfunction, speeds wound healing, burning mouth syndrome. This is a common complication in chemotherapy and radiation therapy for cancer. The mouth is so sore you can't eat. Have to discontinue treatments if this happens. It helps. Alpha-lipoic acid combined help, especially if you add curcumin. Curcumin and alpha-lipoic acid, those 2 powerful antioxidants, help burning mouth syndrome. Combined with vitamin C, lipoic acid benefits periodontal disease, immune modulation, struggling with your immune system. It will help chronic fatigue syndrome, a great remedy. Help to increase your ATP and energy levels. Age-associated hearing loss associated ALA helps to compensate. It helps the ear to actually heal a little bit. We lose our hearing with age. Alpha-lipoic acid helps to reverse that a little. It won't restore it to that of a child. I don't mean to create that impression, but even a 5 to 10% improvement of the hearing, fewer, what'd you say? Huh? What? You know what I'm talking about. Combining alpha-lipoic with carnitine protects from noise-induced hearing loss. So shooters, recreational hunters, and this type of firearms or loud noises, alpha-lipoic acid will help you protect your ears. And of course, wear ear protection, of course, do that too. Migraine prevention decreases frequency and severity of the headache, and it will reduce your headache days. These are all studies. This is not my opinion, these are studies. Helps to prevent bone loss in postmenopausal women, restores the sense of smell after a respiratory infection. You know, sinuses, you can't smell. Alpha-lipoic acid helps to get your sense of smell back. That's amazing. Vitamin C, 1 gram, vitamin E, 100 international units, and 150 milligrams of alpha-lipoic acid reduces acute mountain sickness, altitude sickness. You go skiing and you get a headache, I feel terrible. Take your alpha-lipoic acid, helps to reduce that. Pretty amazing. Alpha-Lipoic with narrowband UVB sun therapy, narrowband, and it's artificially induced sun therapy, reduces vitiligo. We get this question so much. Alpha-Lipoic acid and phototherapy, 50 to 75% improvement in vitiligo. 900 milligrams alpha-lipoic acid restores glutathione levels in the HIV patient. And a topical prep of 5% alpha-lipoic applied to the skin reverses the visible signs of aging. These are some of the unusual things that you may just gloss right over. See, the amazing part about it is now, folks, you know how that makes sense. You know how it works. You took the time to learn the mechanism. That's really how science works at its best. Let's go to our break, and when we return, we'll talk about who would benefit most from alpha-lipoic acid and some dosage guidelines. We'll be right back.
I'm Cindy Becker.
And I'm Dr. Richard Becker. Are you thinking about your health as we approach a new year? Well, many of us do, even though our health is important every day of the year.
If you have a wellness plan in mind, December's a month with special holiday prices. Plus, shipping within the continental U.S. is free for all orders over $50.
We'd like to thank you for your continued support. It's because of you that we are able to provide this great educational service.
So call us today to restock your supplements for the coming year and tell a friend about the savings, or order online at bioinnovations.net for the best prices of the season.
We hope the new year brings you happiness and better health for your entire family. Merry Christmas.
And a happy, healthy new year.
I'm Dr. Becker with Your Health at a Glance. Have you or someone you love recently been diagnosed with cancer? It is projected by the year 2020, some 18 million Americans will be cancer survivors. The main reason for this upward trend is our treatments for cancer are better than ever. Our cancer medicines are much improved, and we know more about how cancer works. In addition, holistic principles of cancer care are becoming standard of care treatment. Plus, research centers are discovering natural substances with true benefits for the cancer patient. This is an age of wonder, as we can incorporate both mainstream medicine and the fields of complementary and anti-aging medicine into your plan to beat cancer. I'm a cancer survivor who's here to tell you that you have more tools than ever in your battle with cancer. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
Welcome back, everyone. Well, I've got to give you one more reminder. I don't want you to miss this one. It is holiday savings time at BioInnovations. Great prices and free shipping on orders over $50 in the mainland USA, so don't miss that one. Well, Richard, who would be the best type person that could benefit the most from supplementing ALA?
Yeah, if you are stuck in poor health,
Okay.
maybe you had a series of operations, 2 or 3 in a year's time, and you are just down and you can't get into that recovery phase. I'm thinking alpha-lipoic acid for you, and we now understand how that works. It assists your healing mechanism, gives them a kickstart, and it works differently than vitamins, and it does what no drug can do. This is probably what you're missing. If you have any of the following conditions in your medical history, you would benefit from alpha-lipoic acid. The research says you will. Diabetes and all its complications. Alpha-lipoic is a fundamental supplement for the diabetic. Diabetic neuropathy, nephropathy, retinopathy, all of them. Amputations, all of them. It helps the blood do its job in that microvascular capillary area. That's where blood works. And that's where your disease affects your circulatory tree, is right there in that capillary region. All forms of cardiovascular disease, heart attack, stroke, peripheral vascular disease, all of them. And even if especially if it's diabetes induced. Toxicology of any type. And folks, we can't discount the effect of pollution in our environment today. Many of us thought once they handled DDT, we're done with the pollution. Not so. They were just replaced with other chemicals with similar names that do the same things. And there's many, many more. Alpha-lipoic acid is a powerful detoxification agent. Musculoskeletal pain, ongoing chronic ruptured discs, pain syndromes. You know, do your holistic approach. Add the vitamin D to it and your healing vitamins, but alpha-lipoic acid helps you with stuck in those chronic conditions. Any type of nerve condition, including spinal cord injuries, brain preservation, anti-aging, it is one of the best we have. And of course, we went through the unusual things like headaches. That's not so unusual, but you wouldn't think that there'd be a lot of research on it, but there is. Side effects, alpha-lipoic acid. Some people get a minor skin rash, and it's not an allergy rash. It's different than that. That usually only occurs with higher doses, but it can happen. Just stop the alpha-lipoic acid, try it again later, and it probably won't come back. That's the typical for it. There's a chance of nausea with higher doses, and diabetics, your blood sugar will come down. You may need to take less medication when you add alpha-lipoic acid to your regimen. Dosage, 300 milligrams sustained release will give you a benefit. But if you're in a tough way, you may want to go 600 a day, 900 a day, 1200 a day. It's well tolerated all the way up 2400, 2700 milligrams a day or more. General good results from 300 to 600 a day. And for health maintenance, 300 a day is perfectly good. Alpha-lipoic acid is one of our most thoroughly studied dietary supplements. It provides near miraculous benefits for the diabetic and oftentimes for the heart disease patient. I could tell you stories that you just drop your jaw. Alpha-lipoic acid. It is well tolerated, does not interact with any medications. Science confirms alpha-lipoic acid is a dietary supplement that can help you. Thank you for your kind attention today, folks. We went through some tough science, but we have a hold of alpha-lipoic acid. We'll see you again here tomorrow, folks. Bye-bye, everyone.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
In the pit of my stomach, I knew it was going to be positive. I wouldn't be in this situation if I would have even been taking it if I didn't think it was going to be positive, but I didn't want to admit that. I turned it over, and there were 2 lines. It was a positive test. I remember just being like, oh no. Like, that was all that really went through my head. I didn't know what to do.
Hear the stories and experience the freedom on Real Life.
This week on Our Jewish Roots, we begin our examination of the kings of ancient Israel and